Today's Neurology Minute features a scientific abstract for the AAN's 2021 virtual annual meeting. Hey, it's Jason Crowell with today's Neurology Minute daily briefing. And today we have another Neurology Minute highlighting a top abstract from the AAN's 2021 virtual annual meeting. And we're fortunate to have Jill Ostrom joining us today. Jill is a movement disorder specialist and deep brain stimulation specialist from the University of California, San Francisco. And today we're talking about her abstract from the 2021 annual meeting titled 10-Year Clinical Outcomes of Subthalamic Nucleus versus Palatal Deep Brain Stimulation for Parkinson's Disease. Jill, thank you so much for joining us. And again, we're talking here about two different stimulation targets for patients with Parkinson's disease, the STN compared to the globus pallidus. And after comparing these two targets over a 10-year time period, what can you tell us about the outcomes for these two targets? And if I'm considering recommending DBS for my patient with Parkinson's, what might nudge me towards one of these targets instead of the other?
So in this trial, we examined patients who are part of a larger pivotal study that was done many years ago as part of the CSP468VA-NINDS multi-center randomized trial. And that study originally looked at patients that were randomized to best medical therapy and then to deep brain stimulation after 6 months, and then went on to really compare the two targets where patients were randomized to STN or GPI. And in those earlier studies, we did not see large differences in outcomes for patients if they were implanted in one of the two targets. They were showing very similar motor outcomes with some other smaller differences in secondary measures. So now we're able to follow some of these patients who agreed to continue in the trial out to 10 years. And at 10 years, remarkably, we're seeing really a maintenance of this motor improvement that was originally seen. So that's really nice for patients to know that if they get deep brain stimulation, that they can likely see that improvement in motor function maintained up to a decade. And so that's really helpful to tell patients. We did not see a big difference, however, between the two targets. So both targets are showing really nice maintenance of improvement of motor function, tremor, rigidity, motor fluctuations. And I would just say, though, that there is still evidence of disease progression in these patients, as you would expect. DBS doesn't cure Parkinson's. So we still see a lot of problems now and disability coming from gait issues and cognitive impairment. And even quality of life measures do not show, as much improvement at 10 years as you would expect. But we're still very happy to see the motor benefit persist.
Terrific. I encourage our audience to check out Jill's abstract as well as the many others you can find at the AAN's virtual 2021 annual meeting. Again, the title of this abstract by Jill Ostrom is 10-Year Clinical Outcomes of Subthalamic Nucleus versus Palatal Deep Brain Stimulation for Parkinson's Disease. Jill, thanks for your work and thank you for joining us today.
Yeah, my pleasure. Thank you.